Good to do, Madam Chair.
the commission meeting to order. Please note for the record that all commissioners are present either in person or via the telephone. So just a few housekeeping things that I'll quickly go through. For individuals that are participating by phone, please identify yourself prior to speaking. Please speak loudly and do not use the speaker function on your telephone. And then please mute your phone unless you're speaking. And once you are done speaking, if you would mute your phone again, that would be great. Any questions on any of that? All right, so we'll start. The first order of business then is the approval of the minutes from July 21st, 2020. Get a chance to look at those. Any comments, changes?
I make a motion to approve.
We have a motion to approve the minutes as presented. Do I have a second? Do I have a second on the minutes?
Second, this is Dave.
All right, so we have a motion and a second to approve the July 21st, 2020 minutes as presented. All in favor signify by saying aye.
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 Opposed, motion carried. Next item is the order of the agenda. Are there any changes that need to be made to that?
Madam Chair,
Yes, ma'am.
I move approval of the order of agenda.
Thank you. We have a motion to approve the order of the agenda. Do I have a second?
Second.
I have a second. All in favor signify by saying aye.
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 Opposed, motion carried. Next item is the approval of the consent agenda. Each of you received copies of bills, employee status changes, overtime, documents, and we have a county deed. Is there anything that you would like pulled for further discussion? Hearing none, may I have a motion, please?
Motion to approve, Tom.
Okay, we have a motion to approve the consent agenda. Do I have a second?
This is Cindy, I second.
Thank you, Cindy. All in favor signify by saying aye.
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 Opposed? Motion carried. Consent agenda has been approved. Next item is County Health Officer reappointment. And back on April 7th, our meeting, we appointed Dr. Joel Waltz as the Grand Forks County Health Officer. And the city has also confirmed his appointment. And so, Ms. Swanson, did you want anything? Did you want to say anything about this or not?
Madam Chair, I'd be happy to make just a few remarks about it and answer any questions. As you know, this is a rather new thing that we have done with Grand Forks County to appoint a separate health officer who just happens to be serving also as the city health officer. And it was a requirement that we discovered as both the city and the county were working their way through establishing non-congregate shelter to meet some FEMA requirements. So we did initiate that in April, and the commission decided that they would do it through the end of July. And so now it would be time to reappoint. I've visited with Dr. Waltz. He's interested in continuing his appointment, and the Century Code allows that appointment for a term of 5 years. And so I have submitted our letter of recommendation from the health department for your action. And then of course, Ms. Wamstead can answer any legal questions that you have relative to this.
Okay. Does anyone have any questions of Ms. Swanson? Okay, hearing none. Ms. Wamstead, did you, okay, we'll start with the motion. Do we have a motion to appoint Dr. Joel Waltz?
So moved.
Grand Forks County Health Officer? We have a motion. Do I have a second?
Madam Chair, this is Cindy, I second.
Okay, and both of these I assume is for the 5-year term. Is that correct?
Correct.
Okay.
Correct.
Any further discussion on that? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried. And then Ms. Swanstead, my understanding is that you visited with Ms. Swanson about, and probably Dr. Waltz as well, about taking the oath and submitting that to you.
Yeah, yes, I visited with Ms. Swanson, and I believe she's also spoken with Dr. Waltz. I will share with both her and Dr. Waltz the standard oath of office document prepared by Ms. Nelson for his signature and sent to the commission.
All right, thank you very much. Appreciate it. Okay, next item then is public health. Ms. Swanson, do you want to start that out?
I will be happy to do that. Thank you, Madam Chair and members of the commission. This is Debbie Swanson from the Grand Forks Public Health Department. And at the request of others, we have included under my report some of the other entities, large entities within the city and county of Grand Forks that are doing quite a bit of work around COVID-19 response and plans for things like school opening and the hospital status and the University of North Dakota. And so we did invite others to attend, and they will be providing a portion of this update. I prepared it yesterday, so the data at the very beginning includes information that is more than 24 hours old, but I can verbally tell you what has changed. So I'll have you move to the next slide. This is the statewide overview as of yesterday. There were 1,090 cases, and 127 reported that day. As of today, there are now 107 deaths in the state of North Dakota, and 51 people are currently hospitalized. You can see on the map there that yesterday's report included 11 new cases in Grand Forks County, and today we had 5 new cases reported in Grand Forks County. Unfortunately, we also had 1 death in Grand Forks County reported yesterday. So if you go to the next slide, this was somewhat of an analysis of just the raw data, where you can see, I thought it would be important for everyone to know what percentage of all North Dakota tests are performed in Grand Forks County. And that's important to ensure that we have testing across the state. And because we have about 10% of the population in Grand Forks County of the entire state of North Dakota, we're pretty well on track with the percent of all tests being administered here. And you'll hear a little bit more about how that's occurring. And then about 9.1% of all North Dakota positive tests occurred in Grand Forks. Unique total tests. 9.1%. So we're doing a little bit more testing of people more than once, and that's largely related to long-term care. And then our total positive rate is 10.65. Our current active cases now have moved from 62 to 63, and that's because some have recovered. And then, as I mentioned before, we have had a total of 5 deaths, and the most recent one being yesterday. If you move to the next slide, this just shows that kind of that same information, just presented in a slightly different way. And there you can see where we had a really early peak in April. We had a nice lower period where we didn't have as many cases identified, but testing continued throughout that time frame. And now we've seen a second surge. Well, it doesn't have the same high number of cases that we did with a workplace outbreak. What we are seeing now is just community spread in a variety of settings. We are seeing a significant uptick among individuals who are in the 20 to 20 year age group. And then the second age group would be the 30 to 39. At one time, that was the largest percentage that we saw, and that was largely due to workplace, but now we're seeing more social activity, leading to more cases in that 20 to 29. And then if you go to the next slide, this gives a little bit more information about where people become exposed to COVID-19. And clearly, community spread is the largest, and that's where we can identify a specific source that's either close contact, household contact, may report that they were in the community doing a particular activity, and so they have no idea really where they acquired it. But 165, which is the next largest, can identify that they were exposed through a close contact, like a coworker, and then 107 household contact members. Travel remains very low at 7 and 8. And then under investigation is always just an artifact that occurs while we continue to do our contact tracing and investigation and determine where cases were exposed and then move them into the other categories. And once again, this was as of yesterday. And then if you go to the next slide, this is a nice depiction of what's currently occurring through a different data source, which is our contact tracing database. And this is very preliminary information, but it does give you a nice overview of both the active cases, the new cases, those cases that are completed, and then active cases per 100,000, which is the trend line that you see there. And the information on here is only as of May 1st. So keep in mind, it doesn't show that spike that we had in April with a larger number of cases, which came off quickly. And that outbreak was really well contained through some robust contact tracing. Now our contact tracing is getting a little bit more complicated because some of the cases have a large number of contacts. And then our last slide is just a reminder that masks are recommended. There's more and more science out there about the importance of wearing masks to protect others in the community. And so we just have a nice visual here of some of our staff, including our health officer and some individuals that were doing testing and family members. And more we're seeing organizations, businesses employing mandatory masks or required masks for entry or for whatever activities there are. And then I just have my contact information there. I have some of our colleagues from the community here today to provide additional presentations. So that information should be following these slides. So the next slide should begin with Altru, and Carrie Jensen should be on the line to present information about Altru.
Oh, is that mine? Okay. Good afternoon, everyone. I'm Carrie Jensen. I'm the Director of Quality and Safety at Altru. And through our COVID response efforts, I've been acting as the Operations Section Chief in our Incident Command. Review a couple data points from Altru here, so we could go to the next slide. Uh-oh.
It's stuck, it's not moving.
Looks like that is the last slide.
90 pages. There we go.
There we go, thank you. Okay, so just to briefly recap some of the services that we are offering surrounding COVID, we have our COVID hotline, which we do offer to it was 24/7. We have reduced those hours to 7 to 7 at this point, but we still are taking in a significant amount of calls. And with that testing strategy, our or more symptom of COVID, or we have partnered with public health to expand our protocol. So asymptomatic patients that have had close contact with a positive patient. So that protocol has seen a significant number of patients. You can see here, as Debbie had indicated, we did have, in April, we had a spike in the number of tests that we were doing, but we did take, just to give a better idea, we took the average of April and May, and we were testing about 55 patients per day. And in comparison to what we're doing now, we are carrying out about 120 tests per day is our average tests that are coming through Altru. So a significant increase in our average through our calls that we have coming in. We have about, I'd say, between 200 and 300 calls during the weekdays that we're fielding through our hotline. And on the weekends, we're dropping down into the 100s for calls. And we have been able to have a steady supply of testing kits, so we have not had any concerns recently with that. That would be for the tests that we send out to be resulted at the Department of Health. We are working with vendors on more rapid testing, but at this point, we still are doing the routine testing, and our turnaround times varies from about 2 to 5 days, just depending on what the lab is seeing. We could go to the next slide. Really just wanted to give a brief overview of our inpatient capacity measurement. So we have surge plans that we operate off of internally, and within our developed surge plan, it aligns with the North Dakota Department of Health surge planning tiers. So tier 1 is going to reflect our ability to care for patients with our existing resources, with our existing staff. Tier 2 is when we end up reaching out to the state for either resources and or if we are reassigning staff from areas that don't typically work inpatient care to work inpatient care. And tier 3 is where we hope to never be, and that would be if we're needing really to get this help with the state to set up alternate care sites and a different method of triaging patients. So we are reporting this tier status on a weekly we just started last week to the city and reporting that. So we are in a yellow status currently. And what does yellow mean? So yellow either means that we are on a diversion or we are capping beds. So there are times where you may have a certain volume, but you may have to limit the number of patients that you can care for because you have staff to care for so many patients. So if we are not diverting any patients, or if we are not capping beds, we're in a green status. And it depends also on the number of employees that we have out. Debbie had referenced community spread. So with community spread, all through a large employer within the city, and when we have employees that are exposed, we all work. So there's a lot of external and internal factors that fall into that. So I wanted to just share our tier level status with everyone. And those were just a brief couple points that I wanted to share today. So I believe if we go to the next slide, it would move on.
I believe our next speaker is Jed Shivers from UND.
Thank you.
Hi, it's great to meet all of you, Madam Chair and Commission members and others. I'm Jed Shivers. I'm the Vice President for the University of North Dakota for Finance and Operations. I'm also the Chair of the COVID Pandemic Planning Committee, and we've been meeting every day, Monday through Friday, since about February 26th. And I want to thank you all for everything that you've been doing to help keep our region safe. And we're going to just go through some slides very quickly, as you'll see once we get them up here. And it should start with the Healthy Hawks. There you go, restart program. Thank you. Go through these slides very quickly. So if you could turn to the next slide, please.
Peter, it's not working today. I get to the next page.
Well, I've got it up myself, so I can take you through it verbally. I don't know if you've all gotten this material already or not, so let's see.
I believe Debbie emailed this yesterday.
Okay, so if you've all got it, why don't I'll just do it verbally, that's no problem. So I guess what I'd like to start out with is we sort of, at least for me, I view what we're trying to do as 3 parts to a triangle to manage the COVID epidemic. And, oh, there we go. That's good. Anyway, so we've got testing, we've got contact tracing, and we've got isolation and quarantine. So I think thanks to your efforts, and I think to a certain extent to whatever we've been able to contribute to this conversation, we've been constantly making the argument for quite a while that college campuses are good places to focus testing firepower. And we can see that happening, as you all know, here in Grand Forks, related to both Grand Forks community-wide testing events and UND-specific events. Our view is college campuses are natural vectors of viral transmission. We want to try and reduce the probability of that viral transmission. And so by testing as robustly as we can, we hope to pick up people who are positive. And that's happening in conjunction with the Department of Health, but I just got off the phone with Ms. Weitz, who's the CFO of the Department of Health, and she told me that it looks like we'll be able to subcontract with the Department of Health to hire contact tracers and really augment the capacity here in Grand Forks. Contact tracers will be working with the Student Health Service to really go after the close contacts here at the university. And then, of course, the last part is quarantining and isolating people. And so we've been working on a series of programs to move people into isolation and quarantine primarily at local hotels. And we already have some people in those areas now, and we're helping to provide them with food service, et cetera. So just really quickly, if we go back, I think, to the why are we different? We'll probably have at any given, just one more slide. Thanks, this is great. So we'll probably have at any given time about 15,000 people on our campus. So we're the aggregators of population in the region. We have an increased volume of human interactions. Of course, that's what universities are. They're built for that. That requires us to be extra vigilant. Next slide, please. So we've developed what we think are just simplified safety levels. We have 3. The first one is we're remote. We're there from remote learning. The university never closes. We have never closed since March, but it's had several hundred people on campus doing research, maintaining essential services. I, for example, have been at work virtually every day. I'm here in my conference room right now. But right now we view ourselves in safety level 2, which is a mix of in-person and online. That's how we're planning to open. So we plan to have our campus up and running and open for online living, learning, instruction, and research and service on August 24th. That's when classes will start. As you can see, it's a mixture of in-person and remote. We will have virtual gatherings will be encouraged. And of course, you may have read that we have far less dense dining and housing options, pretty much operating at half capacity, but we have a large number of buildings that we had closed previously, so we're able to accommodate all the people who are living here with us on campus. So everyone essentially is going to have their own bedroom. And of course, dining will be less dense. We're going to be in that yellow zone until either things get worse or until, from our point of view, there's effective therapeutics and a vaccine. So that's a broad place to be in yellow land, but we think we have to be under those cautions until either we are worsened or we have that level of improvement. Next slide, please. So we look at the safety indicators for us, and there's the number of new cases, ability to test, ability to trace contacts, and the ability for Altru to treat people without entering into crisis mode. Good segue from the presentation that we just heard from Altru. So we're going to be looking at those things. That's part of our determination about what level we're in and what we're going to do about it. Next slide, please. Then we have all the typical things that we're having people do. So there's physical distancing, and we've got all kinds of material up on all the buildings. In my own building, there's how to walk and where to be and what to do. Next slide, please. We are distributing face coverings for free. We have 250,000 disposable masks. We have thousands of branded masks. We hope, if you'll excuse the expression, the cooler the mask, the more likely they'll be worn. And so we have as many branded masks as we can get a hold of. We're dealing with Rough Rider. And there will be thousands of these masks distributed to all of our students, faculty, and staff. I think everyone will get, this says, I think 2. We're probably going to end up with about 4 per person. Next slide, please. Obviously, we want people to wear it. As you may have read, masks are mandatory on our campus. And this kind of gives you the places where we want them to be worn, and they're in both safety levels 1 and 2. Next slide, please. And then, when do they not need to be worn? We want to be as prescriptive as common sense as possible, so this gives you an idea of when we won't be wearing masks. We actually have stratified our testing in conjunction with Sean McBride. We're working on developing a sentinel testing program. We've stratified the campus into risk groups. And so, for example, people who are competing in sports, people who are having to break a barrier and not wear a mask because of the role they play, we view those people as higher risk. Next slide, please. We've basically said what to do when you're sick. Pretty common sense. Next slide, please. And we have a reporting mechanism of what to do when you're sick. And you can see that here. Next slide, please. We always update the coronavirus blog whenever we, have new cases, to the extent that we know it. You can see some of the signage that I alluded to earlier in the buildings. Next slide, please. And our goal, as I talked about before, is to create a less dense campus, have employees who can continue to work 100% remote, or have them rotate between on-campus and remote work. Only people who really need to be on campus should be here all the time. Next slide, please. Just a quick item to show changes in the learning environment with the spacing that's required to be CDC compliant. Generally speaking, our classes are able to operate physically at about 30% of their normal capacity. We've actually measured out every one of our classrooms. Next slide, please. And you can see we have classroom protocol, where to sit, how to space. We're having plexiglass shields for lecturers. We've enhanced the microphones and the audiovisual in all classrooms, thanks to the generous support of the state for the CARES Act dollars in order to promote good teaching and learning. Next slide, please. Here's what we're talking about related to sponsored travel. And it's, as you can see, fairly restrictive. Next slide, please. In terms of dining, takeout's going to be the primary option, and it's going to be far less dense in keeping with the rest of the campus. Next slide. If quarantined, we're going to be providing meal service to people, and we've already arranged for that, and our dining services are loaded and ready to go for that. Next slide, please. As I talked about, less dense residence hall, so all students will have a private bedroom, and you can see the rest of the items. Next slide. And I think this is our important takeaway to our community. If you just scroll, the activity maintained along with what we all want with a campus, please put your mask where your mouth is. And the last slide.
I can get there.
It's just one of those nice, together we can do this, which I really believe in. I think this requires an all-region approach. Thank you.
Thank you.
Madam Chair, I believe our next speaker should be Terry Brenner from Grand Forks Public Schools.
Thank you.
Madam Chair, thank you, Debbie, for the introduction. Terry Brenner, Superintendent, Grand Forks Public School District, along with the Grand Forks Air Force Base School District. I could have just cut and pasted all of my slides that would look much like UND's, but I will spare you. So nice work, Jed, and I'm glad that many of our people have been able to collaborate on school reopening. So I appreciate the partnership, and certainly appreciate the partnership with Debbie and her colleagues at Public Health. They've been nothing but wonderful in working with us on our reentry plan. So I'm going to give you the very skinny version on what our district leadership and principals and a group of teachers, along with our school board, stamp of approval as of last night, have been working on. It is our Smart Restart Plan, and we will have two options for parents and students to choose from. We surveyed parents about 3.5 weeks ago, and at that time, about 8% of our parents said they would keep their students home. And we surveyed our teachers and our support staff as well, and probably had a handful who had medical reasons to stay home. So we were poised to go ahead and create some classroom clusters, some content clusters, and then the COVID uptick continued to move in the wrong direction in our city and our county. And so while the governor has indicated that the state is in the color green, we are operating under the premise that we are actually in the yellow. So we just sent out some information to parents again yesterday to give them an overview of what distance learning will look like and an overview of what face-to-face instruction will look like. And then we followed that up today with a second survey to both our parent community and our staff as well. We are under the assumption, at least one of us is, that 8% of parents who wanted to keep their students home might grow to a higher number. So we'll see by next Monday what that data look like, because then we'll probably be shifting to a little more online distance learning with the number of teachers available and the number of students who will be participating that way. We have had to put this in a plan that will be submitted to the Department of Public Instruction, and that will also need to be approved by the DPI along with the governor. A couple of other just points of interest. We are scheduling a mass testing event for our staff, and it appears that just as of a few minutes ago, there might be another partnership forming where we'll have more than one opportunity to test our staff on a voluntary basis. So where we are at right now, as of today, August 4th, athletics is also part of our restart, as complicated and complex as that is. Allowing them to start, and the school board will hear another second recommendation about what that looks like in terms of fan attendance, et cetera. The board will hear about that next Monday evening. So that is a high-level macro overview of our restart. Just to recap, parents have the choice for distance learning, and staff also have the opportunity to be at distance learning, and parents have the choice to send their students to school, and our staff have the choice to re-enter the building as well. So that's what I have for you today, and I wanted to be respectful and stay within my 3 to 5 minutes. Thank you. Appreciate the opportunity.
Thank you.
Madam Chair, this is Debbie. That concludes our presentation unless there are specific questions for myself or any of our speakers.
Okay, thank you. Appreciate it. Commissioners, does anyone have questions of any of the guests?
Well, this is Dave. I have a question.
Go ahead.
This is for all two. How long does it take to get test results back on the testing that they're doing each day?
Thank you for the question. We're seeing some varied turnaround. We are currently seeing about 4 to 5 days, but it can be as short as 2 days. There's some dependent factors. So we are sending our testing out. With that being said, there's a lot of work to expand the testing capability and see that turnaround time reduced. So we continue to talk about how to make that happen.
Thank you. I think that's really important, especially as we get into testing the teachers and figuring out who can be in the building. So I hope that I know you guys are working on it. So thanks.
Any other questions? I have one for Altru. Are you limiting people, the number of people that are coming into the hospital at this point again, or is that continued?
We did just send out today, I believe, an update on our Facebook post, and I thought there was, I haven't seen it yet, a press release that we are restricting visitors again to 1 designated visitor for inpatients. There are some exceptions. specifically behavioral health. We are not allowing visitors in our behavioral health unit. There are times when we are, the practice would be to allow up to 2 visitors. So for instance, if we have a patient in critical care, up to 2 visitors, and also in our, some of our pediatric NICU areas, both parents. So, and we have exceptions through our clinical team and leadership. But we do feel that it was important to go back down to 1 designated visitor. We had expanded where we could have 1 visitor at a time. But really our focus is to reduce traffic and then really look at that 1 designated visitor at this point.
Thank you, Carrie. And then also, did you say that Altru is at, what is it, level or tier number 2? So you are in the yellow range at this point?
Yeah, we are in tier 1 in the yellow. So we, I would say on the number of inpatient admissions and discharges on what that will look like. So we usually staff to our average daily census, and sometimes those census swings up and sometimes it swings down. So depending on what that looks like. But we are in tier 1. We're still able to care for our patients within our inpatient staff and our equipment that we have. We haven't had to resource from areas outside of the hospital or outside of the inpatient area, I should say, or with equipment needs from the state.
Thank you. Anyone else have any questions for any one of the guests?
Madam Chair, this is Haley Wamstead. I would just note that I see Dr. Waltz has joined us, so maybe before we move on to the next agenda item, we could do his oath.
Okay, we will do that. I'll put that on there. Debbie will remind me. So thank you and welcome, Dr. Waltz. Ms. Swanson, my question is, thank you so much for, or my comments are, thank you so much for giving us Grand Forks County specific information. We really, truly do appreciate that. It's a better tool for us as far as guidance and things like that, and knowing what the situation is in our own community. And so is there any way possible that we could get that information, like maybe on a weekly basis?
Yes, I think that would be possible. What I share with you is primarily just the information that is presented each day by the Joint Information Center. That's what I forward on to you each day. Yeah. But we are working on combining some of the information into graphs that are a little bit more, they're easier to read and a little bit easier to tell what the trends are. And some of it we can share publicly and some of it we are restricted by Century Code. But we're working with Dr. Walls actually to try to package more of that information and get it out to policymakers so that you can see in closer to real time what it looks like.
That would be appreciated. So, commissioners, other questions, comments? Okay, so Ms. Swanson, again, our risk level in Grand Forks County as of today is what? Where are we?
Well, that's a really good question because the risk levels are determined at the state level right now. And in fact, for schools, the governor has determined that all schools are in a risk level of green. But we feel that that's probably not appropriate based on the increased number of cases and positive tests and positivity rates. So if we took the 11 criteria that have been established by the state and applied that across our information, and in fact, we've done that in a couple of different models, we would be much more in a yellow or orange on a scale of green, yellow, orange, and red. And so I do think that that impacts policy decisions and planning. And so it is our intent to, as local health departments, we have all asked the governor for the ability to do that on a county level basis, determine what our risk color is, so to speak. And that hasn't come forward, but I think it would make sense for us to do that as a health department, as a health officer, to establish a risk level that's specific to our county.
Thank you. I think that, would there ever be possibility of having that information also released to the public? It's, so often I'll have people say, you talk about the risk levels and where we are and what have you. And so they see us, they have knowledge of, the information that the state puts out, but they don't recognize that counties are unique within the state and have different situations, like Fargo, Burley, Morton, Grand Forks. And so it's kind of like, well, we're in the green, so we're not going to worry about it. But that isn't always necessarily true. And so how is it that we get accurate information out to the public?
Well, that's what we're working on. And I think that we will have, we actually did release some of that information last night during the city council meeting. We're hampered a little bit by the fact that we have not had an epidemiologist on our staff at Grand Forks Public Health Department. And this has been an experience that's really highlighted the need for that, because it would be an important position to have, not only in times of pandemic, but other times. But this has really highlighted the need to have somebody solely dedicated to receiving data, analyzing data, and getting it out to the publics and to the policymakers so that it becomes a better decision-making tool. So we reassigned someone within the department, Michael Dulitz, to work on that, and he did present some information at the city council. And I do believe he would be willing to do something at the next county commission meeting if that would be your desire. But in the meantime, we will release what information we can that's county specific.
Thank you. I'm just looking at my questions here. My position on preventative kinds of situations or things that we could do. And well, good testing, I believe, is a critical tool for us to have, and glad that we have it. From a public health perspective, do we need to do more with respect to restrictions and enforcement, if that were possible?
If that was a question to me, of course I'm going to say yes, because there is a lot more we could do relative to restrictions. And whether it's by order or simply by encouragement and public information, there's a lot more we can do, especially around large gatherings, around wearing masks, and around compliance with contact tracing and isolation and quarantine. I think that we spent a summer thinking that this was going to go away or that things were going to get better, and people relaxed they let their guard down, and a lot of people have gathered in families over the 4th of July, at weddings, and all kinds of events, and even events that are happening throughout our county. I see business socials, concerts, all kinds of things that concern me because they do provide an opportunity for that community spread that we talked about. Obviously, the science is really clear on masks, and wearing masks really cuts down on the transmission in the way that we know can be the most effective, not to mention that it's very inexpensive, as well as social distancing. They're very inexpensive. They don't require vaccinations or therapeutics. They are our best tools, along with containing it through that contact tracing process. We appreciate the support that we've had from Grand Forks County Commission. It's been strong and it's been positive, and we do appreciate that.
Thank you. I guess my biggest fear is that, we're going to see our health and our economy get worse before it gets better. And my thoughts are, without healthy people, we can't have a healthy economy or a good quality of life. And so I don't want to see us in a position where we end up having to close down again and having the virus run rampant through all of our organizations, including the individuals, the guests that spoke today. And so, in 4 or 5 weeks, that picture can look totally different. So I'm not sure with the individuals that are guests today, and I don't mean to put you on the spot, but I think that this is a community issue. We're all leaders in our community, and not sure, you've done great planning as far as within your own institution there, and I recognize and I appreciate the unique challenges that you folks have within your own organizations, and I fully support and applaud you, each of you, for the plans that you put in place today. But my thoughts is that we need to go another step further. And so I don't know if there's a willingness, or if there is, if you share similar concerns or not, but if you would be willing to meet again at some point in time where we could maybe talk about and we'll do some brainstorming with some of that so that everyone's needs are met. I think that, we as leaders need to do everything we can as it relates to prevention and enforcement for the overall health and safety of our community and the public that we serve, and the public deserves that, and our community expects that. And so I think that we need to have a unified group that can move forward with that. And I know that there is a group that's meeting, has been meeting from the mayor's office. Well, not from, but they're the lead in that with respect to, what's the title of that group, Tom Ford?
Madam Chair, it's the institutional partners.
Yes. And so just curious for those members that are part of that, if that would be a discussion that you would ever care to have or be part of. I think as a unified group, we can make some things happen. And that's all I have to say on that. So any other questions from the commissioners? Okay, hearing none. Thank you all for participating today. It was good to hear and see your plans. And again, applaud you for a job well done. So take care and stay safe.
Thank you.
Okay, and so we have Dr. Waltz and Haley. Ms. Wamstead, did you want to do the oath of office?
Madam Chair, Ms. Wamstead sent me a note. She got called away temporarily, so I think she had to step away.
All righty. Well, welcome, Mr. Waltz, and we,
thank you.
yes, it's nice to see you or meet you. So, and welcome. Anything you'd like to share with us?
Doing my best here. It's been, of course, very busy, and I'm here to support the county health and hope that we can continue to work together. So I rely on a lot of other people to help me to do the job that I'm doing, especially Debbie Swanson and the team at the health department. So anyway, it's good to be here. Thank you.
Okay, and we look forward to continuing working with you. So, Ms. Wamstead, you're back. Did you
Very well
want
done,
to-
thank you. Would you like me to do the oath right now?
I would. That would be great.
Okay, Dr. Waltz, if you could raise your right hand and repeat after me. I, Dr. Joel Waltz,
I, Dr. Joel Waltz,
do solemnly swear
do solemnly swear
that I will support the Constitution of the United States and the Constitution of the State of North Dakota,
that I will support the Constitution of the United States and of North Dakota,
and that I will faithfully discharge the duties of the office of County Health Officer
and I will faithfully discharge the duties of the County Health Officer
according to the best of my ability, so help me God.
according to the best of my ability, so help me God.
Thank you.
Thank you.
Thank you, congratulations.
Thank you.
Okay, the next item that we have on the agenda is Robin David. Robin, are you there?
I am here, yes.
Welcome.
Thank you so much. Thank you, Madam Chair, and thank you, County Commissioners. I appreciate the chance to visit with you all a little bit and give you an update. I think the last time that I spoke to you all was last summer, and so it's been about a year, and we've had changes to the direction that the Welcoming Project is going, and so I'm grateful for this chance to give you an update and talk about further involvement with the county. So I'll keep this brief, but we'll start with just an overview of the project. For those of you, some of you have been familiar and hearing about it throughout the year, and some of you, probably haven't heard about it since last year. So just as a reminder, this is an effort that was put together a few years ago, and it started with the technical assistance grant that the city of Grand Forks received, and then ultimately became a project that 80 people worked together on the development of it. And as well as that, we had 40 different organizations and institutions that took on the role of a lead agency or a key partner in carrying out these efforts. It's a 5-year plan, and we're currently a year and a half into that 5-year plan. And the aim of it is to ensure that all residents have opportunities to, all newcomers specifically, have opportunities to connect here and to put down roots and to grow. We have 4 specific goals with the project: access to services, advancement opportunities, economic opportunities, as well as connected communities. And so while it started with the city's immigrant integration initiative, the focus is beyond immigrants specifically. It's focusing on anybody who comes to Grand Forks, whether they come here this year, whether they have had many people who have said, you know what, I came here 10 years ago and I still feel like a newcomer sometimes in the community. It could be people who came here from a close distance away, people who came from across the world, people who were attracted to the university, who came to the Air Force Base, who came here for employment. So it has really a broad focus that is helping the community to become more connected and make sure that people have opportunities to meet their needs here and to be able to grow and thrive and put down roots. It was in its first, again, we're a year and a half into the project. The city itself had housed a position during that first year and a half, a part-time position, to coordinate all these efforts and lead this project with, again, over 36 different agencies in Grand Forks who are working together. We know that with many of the changes that we have been seeing and facing over the last, in 2020, have really demonstrated why this work is so important. With things like census, it's really helped us to reach out to traditionally undercounted populations. We also know that, again, immigrants aren't the sole focus of this, but many of the initiatives do have to do with immigrant populations. Last week from New American Economy that demonstrates that in the Grand Forks region, while immigrants themselves make up just 4.2% of the population, they are represented very, very highly in some key industries that we are depending on as a region right now, including they're represented at triple that rate within the healthcare industry specifically, very high numbers within education and within manufacturing and retail. So it's very much one of the backbones of the efforts that we've been seeing in the community. So very, very critical efforts that the Welcoming Project has been able to address during COVID and during census. The changes that we have right now within the program is that the Welcoming Project is going to continue. We still have all of these partners working together. The county has been one of those partners too, and we've been grateful for that. Emergency management has been one of the key areas of involvement, and Kari Geltz is actually on the steering committee for the project. And we've also been working with Grand Forks County Social Services, who was involved throughout the implementation and development of the project as well, Air Force Base. And where the project resides now is that there is not a home for the coordination of the effort. It's going to continue to be a mayor's initiative. And the city will be providing $15,000 a year for this project. Just for reference, the budget for it this year had been set at $65,000. So that's about what it would cost to run with operating expenses and a position and benefits. And so the city is committing $15,000 a year for the project, but it will need to be housed, the coordination will need to be housed in a separate organization. So right now, the steering committee, and I'm here today on behalf of the steering committee, we are looking for a new home, and so we are in talks with, it looks like about 5 or 6 different entities across Grand Forks right now. They're all processing this, having discussions with their governing agencies, their boards, to decide if we could possibly have a home there. And we're also putting together a collaboratively funded effort to be able to continue this position wherever it might be housed. And right now, Councilmember Doppler, who is she's actually one of the chairs of the steering committee for the Welcoming Roadmap, she reported yesterday at the city council meeting that she and the steering committee have put together, at this point, it looks like about $20,000 from various entities in the community, private and public, to create this partnership to fund this position wherever that position ends up being. And I do want to clarify just one detail in the email. A lot of things have been changing quickly, and a lot of details, lots of phone conversations. I just wanted to clarify that the email information about that I would be the one carrying out that work in a new home, that's not necessarily the case. We don't know exactly who might be carrying that out. That's a side issue. But we are putting together funds so that that position can continue somewhere with someone. And that was one of the reasons why we wanted to check in with all of you today and give you some time to think about that. Wondering if the county might be willing to be involved at the level of even a $2,000 donation for next year to help us reach that total, that we can continue coordination of this effort that focuses on city, county, also extends a bit into East Grand Forks.
Thank you. Commissioners, do you have any comments? Ms. David, is there anyone else that's willing or going to speak today?
No, Councilmember Doppler had considered being part of this conversation, but she's actually speaking to another group about funding at this same moment. Okay. And so, so I'm covering this session, and she is covering the other session.
All right, thank you very much. Commissioners, any questions that you have of Ms. David?
This is Dave. I have a question.
Yes, Dave.
I didn't quite hear what it is that you would like us to assist you with. Did you say it? I'm on a telephone instead of regular Zoom, so I wasn't sure what you said about what kind of help you need from us or would like to have from us.
Yes, thank you. At this point, we are requesting $2,000 for the next fiscal year, for 2021. $2,000 from the county to help continue this position wherever it will be housed.
Thank you.
Any other questions?
Madam Chair?
Yes, ma'am.
I do have a question. The $2,000 that's being requested from the county, does that have to wait to come in the 2021 budget, or could that be taken from cash carry forward at this time?
I think that could come at any time. Right now, the situation is rather fluid, and so we are working with whatever happens to work best for the agencies who might be willing to donate to this or contribute to this fund, and also to the organization that ultimately agrees to house it. So things are very flexible, and I think it could be received 2021 or 2020, either one.
Thank you. Debbie,
Yes,
do we have funding in cash carry forward to cover a $2,000 donation to this group? I think it's very important. It is a part of economic development when people are moving into the community, that there's a welcoming group to welcome them. I believe it's quite important.
Madam Chair, Commissioner Peach, I think that we have to have a service agreement and that the commission would not be allowed to do a donation. But if you had a service agreement, I think you could do that.
So Haley, could we have a service agreement for economic development with this group?
I think, Madam Chair, members of the commission, if there was some type of service that this organization provided to the county or citizens of the county that we could identify in a service agreement, I certainly think that would be an option.
So, Ms. David, is this, I mean, I think I talked about this before. This group goes beyond the city of Grand Forks into the county, is that correct?
Yes, that is correct. We do have partnerships with, and our reach extends beyond into the county and into East Grand Forks as well. The role that this position has played up until now in that first year and a half of the project was in part coordination for the specific initiatives that are part of the welcoming roadmap, some of which involve the county. But beyond that, it also served as an equity and inclusion resource for area organizations. So that was another element that could potentially be considered in a service agreement. Equity and inclusion counseling, for instance, or consultants, cost a fair amount of money, and to be able to have someone within the city or within the community who is able to provide that consulting type of service is really a benefit. And that could be, in addition to the specific initiatives that we are carrying out with the county, it could be an added element of doing some additional consulting type of role for entities within the county.
Have you visited with EDC with Keith Lund in economic development issues in when people are moving into the community for employment?
Yes, we've actually been the three organizations that have carried the most with this project have been the city and EDC and Global Friends. They've taken on more initiatives. And actually during this past year and a half as well, or the last couple of years, I've also had a guest spot on the EDC board of directors to be able to be part of those conversations. Becca Kruger has been a member of the steering committee from EDC, and she is now one of the new co-chairs of the steering committee. So we have been in conversation with Keith Lund throughout, and they've been a great collaborator on this effort, because we've been rooting it very much in economic development and workforce issues.
Madam Chair?
Yes, ma'am.
Would it be possible for this group to work with, say, Ms. Wamstead to put some type of service agreement together so it could come before the commission and we could look at the funding for $2,000 to support this group?
So we could, yes, definitely. My
Madam
question
Chair.
is this for 2000 or 2021? 2020 or
We're looking at
2021?
2021, but I think that whenever the funding comes available, I just believe it would be important for us to support this in the realm of economic development.
Okay, but with you, Ms. David, the program is funded for 2020, correct?
Partially. The city has committed an extra $15,000, which is less than was originally budgeted for this this year, but has committed to $15,000 for the remainder of the year. At this point, the program does not have a hosting entity, and so that money is not being utilized while there's nobody who is being paid to coordinate the efforts or to carry out those programs with an operating budget. So differently, the budget would have been more for this year because we would have been implementing some programs too. At this point, $15,000 will likely cover the majority of the expenses for 2020, but some of those expenses were programs, trainings, for instance, that would have involved gathering people together, and there's a chance that some of those might get for 2020. Some additional funds might help with carrying some of that out. And the biggest need right now is 2021.
Okay, and so I'm confused because I've watched the city council meetings, and so I thought I was following it, but maybe I'm not. It seems different today, but my understanding initially was that the city wasn't going to discontinue the program and that the mayor and his staff were going to be picking up the duties and the responsibilities. And my thoughts were is that there were funds for the program, we guess, in this year's budget. And so are you saying now that, okay, so the city isn't going to continue with the program other than it be an initiative and only fund the 15,000? Is that correct?
That is correct. So and there have been
for this year and going forward.
So the actual coordinator position, which is the position that I had, that was ended on Friday. So as of today, there is no position to do this coordination effort. When that position, the city will provide $15,000 to help an entity, whether that be another nonprofit or a new organization, an existing organization. The city has committed to giving $15,000 to that entity for the remainder of this year, and then $15,000 for 2021 also. And the city has committed to ensuring that all of the initiatives that they had agreed to, the Welcoming Roadmap consists of 78 initiatives, and all of those that had been city initiatives will continue. It will still be a mayor's initiative, but the position, we have been told, would not, in whatever kind of form it would take, even if funding is received from other organizations, that funding would all need to go to an outside entity because the city would not have a staff member as the coordinator of this effort any longer. But they will be continuing to, the city will continue to be involved in it, but wants it to be coordinated in an outside entity.
Mr. Ford, did you have any comments?
Madam Chair, if the board would like, perhaps Ms. Wamstad and I can visit offline with Ms. David, and go through some of the Welcoming Community Roadmap strategic initiatives, and we can probably work to define some specific service areas that the county could take advantage of. And then we can also share those with Ms. Beach offline as well, and then bring back what we have to the board on the 14th, which I believe is the next commission meeting.
I would appreciate that, Madam Chair.
Fellow commissioners, is any comments? Everybody's okay with that?
Yeah, Madam Chair, this is Bob. I would like some more clarification from the city of Grand Forks on where they're going with this. Because I heard, like you heard, that they were going to continue to do things with that program. And I guess I would just like some more clarification.
Well, yeah, and I wasn't aware that had changed. So when you're talking about it's their initiative, but what does that mean exactly?
I don't know if you,
Commissioner Knopf, you cut out, we didn't hear the whole question.
Okay, well, you talk about it being, the mayor's initiative, but yet the city's not going to be involved. What does that
Yeah.
mean?
Sure. And perhaps Mayor Boczynski would appreciate that opportunity to have that discussion. He has committed to with the project and absolutely will be doing so. The official coordination of it, of having someone who is holding all of these pieces together and checking in with agencies and working on them and carrying out some of these pieces, he believes should be done by an organization that's not the city, while the city itself will still be, it will still be a mayor's initiative. One of the parallels, again, some of these things are being worked out as we speak, but one of the parallel topics of discussion through this process has been something like the mental health matters coordination, which is a community-wide collaborative, but the school district in that particular case with Jeffrey Gottler is the person who is coordinating that, even though it's something that the city is a lead on, but it's being coordinated by an outside entity. So that's not exactly a parallel, but that might be the path that something like this would go. So the mayor will continue to be involved and the city will still carry out the specific initiatives that were signed to it, but the actual coordination of the effort would need to be done by someone other than a city employee. And that's where we're looking for a new host for that.
Commissioners, any other comments, questions? Hearing none, Mr. Ford, if you want to get together, you and Ms. Wamstead, get together with Ms. David and maybe get some further information as to what this all means, and get some clarifications. It's not that you haven't done a nice job, Ms. David. It's not that. It's just that there's a lot of confusion out there on that whole business. And so we would need to understand that. And also, Ms. Nelson's correct in that we would need to have a service agreement also before we could move forward with anything. So if you are able to put together something, get together with Ms. Wamstead and Mr. Ford and bring something back to the commission, that would be appreciated, and we certainly will take a look at it at that point.
Absolutely. Thank you so much.
Thank you. Take care. Okay. Next item then is Karma Hansen, Safe Kids Grand Forks. You with us, Karma?
I am. Can you hear me okay?
Can you speak a little louder, please?
Hi, I'm okay. Can you hear me better now?
That's better.
Okay. Well, thank you, Madam Chair and Grand Forks County Commissioners. My name is Karma Hansen, and I know many of you. I am here today with a proposal or with a request. You received in your packet, I believe it's on page 43, and it outlines, I don't want to repeat everything that's in there if you guys have had the opportunity to look at that, but it outlines the current status of Safe Kids Grand Forks. We have been, All True Health System has served as the lead agency for Safe Kids Grand Forks for the past 28 years. And we are one of 440 coalitions around the United States. And as the lead agency, All True Health System has been incredibly generous over the last 28 years in providing all of the salary dollars that we have needed for Safe Kids Grand Forks. And as we have been started out as a one-person part-time and extended into doing a lot more work not just within the city of Grand Forks, but throughout our region, and taking on coordination roles for a lot of activities, including child passenger safety, pedestrian safety, back to school safety, bike safety, home safety, water safety, and a lot of other topics that kind of fall under that. We have our goal, I guess, as the lead agency is really to bring together any entity within the city, the county, the region that has anything to do with childhood injury prevention, and bring them in under the tent of Safe Kids Grand Forks. And I think we've been really successful in doing that. And if you looked at the sheet that was included in the packet, you will see a sheet that we put together called Safe Kids by the Numbers. You will see that we interact with 266 agency partners. We have 357 coalition members. We have a network of 75 car seat technicians and 2 instructors. In 2019, we had 8,900 hours of volunteer time that were donated towards the work that we do, and that you can see kind of the number of events and activities and things that our coalition participated in. And I don't want to repeat all of that, but I want to open with that basically to say that our coalition has developed into a network that is quite vast. It's quite interconnected, and we bring together a lot of people and entities where we help to lead the volunteer coordination piece or the training piece, or to bring people together at the table around the topic of childhood injury prevention. And as you can imagine, with a community that values the kids of the community, unintentional or preventable injuries are their #1 cause of death and injury. And being based out of a health system, we've been able to see our injury data over the years decrease. We've seen things like helmet use go up. We've seen things like traffic or child passenger safety misuse in motor vehicles. While the national average of 85 to 93%, our average within our community has gone down to right around 50%, so significantly less than the national average. We, as I said, Altru Health System has served as the lead agency for Safe Kids Grand Forks since we started. And hospitals do serve as the lead agency for about 50% of the are based out of a fire department or a police department or a county entity. They could be based out of an insurance or another nonprofit. With obviously the issues going on within the healthcare industry within our community, with *1, us looking to build a new health system or a hospital because of the structural issues. And then enter COVID that had our health system take a really big hit because of having to limit the number of kind of revenue producing procedures and that kind of thing. Altru Health System is in a position, and it's no surprise to the community. I know the community is well aware that on June 1st, there were 167 positions that were let go because of financial strain. And with that, we had 2 of our positions that we hadn't filled yet, where people had left, that we were no longer able to fill, and they actually terminated the position of one of our gals who's in charge of our child passenger safety work. They were going to let go of Safe Kids altogether, but knowing that it's never been just about Altru. Altru just happens to be the entity that has funded it for all these years, but Altru knew and understood that this is really a community, a county, a region-wide owned effort, and they knew that we had a very strong network of people who knew and understood the value of our work and the connectedness that we bring to the different entities around the topic of childhood injury prevention. And so they approached me and said that they kept me in my position with the idea that they wanted to be able to find a way to keep the Safe Kids program alive within our community and region with less financial dependence on All True Health System. And so what does that mean? At this point, what I did is I pulled together a community stakeholder meeting in which we had 42 members of our community from different agencies and businesses that attended that meeting. And we took a look at, and the first thing I said at that meeting was, I am not offended in the least if the people sitting in that room felt that, the life expectancy of Safe Kids had kind of come to an end and that there wasn't that need or there were other organizations that could take that on. And they immediately said that it was an incredible value. And when we did a value survey, the value rank of how important is the work that Safe Kids does to the community was a 92% on that value survey from our stakeholders. And so the next question became, what does the future of Safe Kids look like? And we were had a conversation in that room that day and probably left with more questions than we had answers, but we got the ball rolling. And you'll see on the 4th page of that document, if you go down one more, it will talk about our current strategic initiatives. And one of the questions that came up was, do we find a new lead agency, someone that will take on the financial piece that All True has been so very generous with over the years? That was an option. Do we look at forming our own 501c3 organization, which that is an option? Or do we look at seeing what we could do to fundraise to help with that positions and that budgetary need with the idea that the All True Health System would stay as the lead agency? We talked about all of those that day, and Christy Hall-Duran, who is my executive vice president, really said that that was not a decision that only she could answer, that it would need to be a decision that would be answered by the executive leadership team within All True, as to whether we did have somebody ask at that meeting if we were to set out and do a 5-year coverage of that annual cost, salary cost and operational cost, if that would help to bridge All True kind of through a little bit tougher period of time, and really kind of in gratitude back to them that they have taken on this full cost expense for our community and region for a long time, if that would be something they'd be amenable to. And so that is what we're looking at right now, is an option. We did have a very invested stakeholder who rose up at the end of the meeting and within a day of that meeting had secured funding for one of my positions to be brought back to assist through the end of the year to help with our monthly or with our Parsley checkup events and a lot of the trainings and things that we do, our babysitting classes and all that. And that same person offered that he would be willing to form a fundraising team to secure half of our budget per year for 5 years, if we could look to the city and the county and the state for some matching dollars. Mayor Boczynski was at that meeting. He was very interested in finding a way to find support for the Safe Kids work. And I've also had a really great meeting with the state also about seeing if it would help to be a part of that $125,000 times 5-year commitment that the fundraising team is looking to do a dollar per dollar match on. And so right now, I guess knowing that we need to approach All True with something to say, we need to figure out what that offer might look like, and that's why we brought so many people to the table, because at this point, All True's financial commitment and obligation is done as of December. And so we're kind of working on a quick timeline here to try to come together and see what we could do to continue the work that is being done by Safe Kids. And with that, Chairman, I will leave it at that. Again, I know the information was included in the packet. I don't know what questions you might have, but I do want to be respectful of your time. And if there are questions that I can answer, I'd be more than happy to do that. I will mention also that, I have had conversations with Commissioner Ross. Bob has been a member of our Safe Kids Coalition for since it was founded in Grand Forks 28 years ago. He was one of our very first people, a part of our coalition, knows the work that we do. And certainly Andy Schneider, our current sheriff, is a part of our coalition now, and really encouraged me to reach out to the community and to the commission, the county commission, to see if you would entertain a proposal to look at doing some funding per year for the next 5 years to add into that pot of what we could bring together from the city, the state, and the county that would be matched dollar for dollar with the fundraising team, that then we would have that match to offer to All True would this be amenable for you to take this on if we found other entities to carry that weight for 5 years.
Thank you, Karma. Does anyone have any questions of Karma? Okay, well,
Madam Chair, this is Mr. Falk. I just have a comment. I think it's a really worthwhile program. It's been in the community for a long time, and in my mind, it saves lives. I'm going to say this, that to start with, the commission right now has to be careful about going to the well too many times, because our budget has already been set, and this is both of these last incidents, and plus Mr. Ford and I have a big one that may need changing down the road, which is actually a county involved matter previously. I'll go back to, I didn't want to finalize our budget until August 10th if we could, and that might have helped us solve some of the issues. But both of these requests probably should go to, should have been in June. I want to say that I want to find money to try and help this program if we can. And I hesitate because, once again, it's taking on another commitment that lasts for years, which the taxpayer has to pay. And we have to assess taxes for that. So I'll be in favor of helping this program, but we'll have to do it in moderation. Thank you.
Thank you. Any other comments?
Madam Chair, members of the commission, this is Sheriff Andy Schneider. I just wanted to make a couple brief comments, and I've talked to Ms. Hanson about it a couple times. But I was in that meeting that she held the other day, and afterwards I asked who she got funding from, and she said nobody but All True. And my perception of that is, to be abrasive about it, we've really been taking advantage of All True in this service in our community, in our county for several years. When you look at the impact it's had on the county, not just the city of Grand Forks, but outlying cities in our county, the assistance they've provided the sheriff's office, the ability to conduct training, train our officers, deputies on things, provide training and assistance to areas in the community. It's been very, very impactful. And, I was just shooting some numbers off of Karma, not literally, throwing some numbers out for her. And, my perception is this is something that we need, that the county couldn't even afford to take on themselves to replace what they do. For me to try to even have a deputy do part-time what they provide to us for the service in the county would be impossible. And especially for what the rate we've been getting it at. I'm not here to suggest any motions or make any advancements on the contributions, but I thought that $25,000 would be a fair amount to maybe propose contributing, which would involve a contract for services, which would be extremely easy to write up, in my opinion, for all the services they've been giving us over the last 20 plus years, putting it on paper and signing a contract on that, giving Altru an opportunity to get 5 years to get on their feet. I think that that's fairly reasonable. And I know that our office and the kids in our community and their parents and families would be appreciative of that. That's all I have for you.
Thank you, Sheriff. Well, and I know too that Save Kids does wonderful things. I follow them on the Facebook and see all the good things that are being done there. The problem that we have, Karma, is that the board's already approved our 2021 budget, and we can't increase our budget at this point in time. And so, I don't know what it is that you are looking for, how much you're looking for. And I'm not sure where we could go with that. Ms. Nelson, do you have any comments?
Madam Chair, members of the commission, it would be the same situation as the last request, is that you would need a service agreement. I don't think you would have an issue writing a service agreement, but you would need one. It would have to come from cash carry forward. That budget could not be amended to tax. It cannot be increased. We cannot do that at this point. It would just have to come from cash carry forward.
Okay. So Karma, what is it that you're looking for?
So, Madam Chairman, County Commissioners, I guess, as you can imagine, I wish I could have come to you with this back in June or July. I wish I didn't have to come at all. But unfortunately, I don't think we predicted what was going to happen in the middle of June when I found out that this was going to be happening. And at that point, when in the middle of June, when I found out what Altru's position was and what they were asking me, my first reaction was not, I'm going to run to the city and the county and the state and ask for money until I get a team of our stakeholders together. And I wanted to be really thoughtful about that. And being very conservative, I'm not going to go out and just ask for money that we can't justify the numbers of what we're doing, the impact that this would have on our health system, on our county, on our city, on our police department, all of the entities that we impact, county social services and Lutheran social services. And I mean, just, it goes on and on and on. So I needed to be able to have some of that to bring to our stakeholder meeting. That meeting took place 2.5 weeks ago, at which time then it began to be this formulation of a plan. And that's just hard costs. There are other additional costs that Altru puts into that as well that are not included into that. Our hope is that we can go to Altru and say, we have a plan for the next 5 years to help Altru kind of get over this hump, with the idea that in 5 years, would they go back to doing what they've done for the last 20? And I think, Sheriff Schneider said it very well. Altru has literally funded childhood injury prevention in our community and rather than us being upset or disheartened by Altru, I think we should be expressing extreme gratitude and saying, now if this is important, are there other people that can come together? The fundraiser, the person that has agreed to do the fundraising for us, has said he'll do 125 if the city, county, and state will do 125. I have entered conversations with Mayor Bochensky, and I've entered conversations with the state. I'm working on a proposal for the state right now. I'm just going to throw out a number that I think would be a number that I'll probably ask the state is $50,000. So I don't know if that helps. And here's the other thing. I will be happy to keep you apprised of if there's more or less than that. I'll be happy to keep you apprised of, where Mayor Boczynski ends up with some of his work that he's doing, so that I can come with a more succinct ask. But for right now, you kind of know what I know, I guess is what I'm here to say.
So you're asking for 50,000, is that what?
I believe that my ask to the state will be around 50,000.
How about your ask to the county?
I think that will be dependent on what we're able to get from Mayor Boczynski and the city. And he's working on that process right now.
Okay, so, and another comment I just need to let you know is that, with our service contracts and things like that, we do those annually. And so we wouldn't be able to enter into a 5-year contract with you. So I don't know.
And I understand that.
Okay, so I just wanted to make sure that you understood that it would be year by year, depending upon our finances and things like that.
Absolutely.
Again, I don't know that we're in a position right at this time, or we have enough information at this point to make any kind of a decision. And so you are welcome to come back before the commission when you have further information or more specific kinds of information, dollar amounts. And of course, there would have to be a service agreement that would have to be approved by the commission as well. But, and so I can't give you any indication at this point if that's even going to be a possibility. And, but I'm just trying to be upfront with you on steps that need to be taken before we could even look at it and consider that.
Yeah, Madam Chairman, and Commissioners, I appreciate that, and I guess I was not expecting to get any type of an answer today. I guess I wanted to begin the dialogue, and we're obviously trying to do that as quickly as we can, knowing that we kind of have a December deadline that we're working up against. That being said, I've come to you as quickly as I could get my ducks in a row to know what's happening and to come to you. And I've got a lot of balls in the air of other opportunities and things that we're looking at, but didn't want to wait to start that discussion till after I had an answer from the city or an answer from the state. So I'm, but I would certainly like you to keep it in your mind and, kind of juggle around what it is that you might be able to do to help. This program isn't about me, it's about the kids, and I think that the county needs to step up and say what is it that they're willing to do to help with that.
And it isn't that we're not willing, but finances truly are an issue for us. And so I'll just leave it at that. It's tough times for a lot of people, and it's no different for the county. And again, like Commissioner Falk says, we've got some big projects that that we're going to have to address as well, that are must-do type things. And so again, we're willing to listen, to hear what you have to present, but I'm just going to leave it at that. That's the best we can offer to you today. So, and but we appreciate your coming forward, and we appreciate all that you do with Save Kids, because it's a great program. So thank you.
Yes, thank you so much, and,
Yep.
and thank you for the work that each of you do as well.
Thank you. Take care.
Madam Chair,
Yes, ma'am. Yes, sir.
I want to go back just a little bit on that. The problem is the number, I think, or the amount of money that's needed. Although I'll say this about this program, there isn't another program in the community that steps up to assist or take its place. Whereas like the previous ask, community roadmap one, social services, churches, etc., assist in a lot of that activity. But as far as the kids, this is willing to work on this. Although the number is gonna be the problem, and at least for that first year, I don't see how we can come up with a significant number. I'm thinking our number would probably be in that $2,000 to $5,000 range, which isn't going to help Ms. Hanson substantially in 2021. But if we can get past 2021, maybe we can do something in our next budget for her.
Thank you, Mr.
Madam
Fowles.
Chair,
Yes, sir.
Madam Chair, this is Dave.
Yes,
I have
David.
a question for, a comment and then a question for Debbie. I agree with the Commissioner Falk. You know, when you look at these cash carry forward things where we hope to have money at the end of the year, I guess the question for Debbie is there going to be anything at the end of the year to be making payments like this? And secondly, we did do 10,000 a year, budgeted, of course, for EDC. A few years back, I think we didn't do it this year, but it was 3 years in a row. So I think we can do that kind of thing at some point, but I don't know how we could possibly swing 25,000 this year unless we've got a whole lot of cash that Debbie has been tucking away for a rainy day. So Debbie, what's your response?
Madam Chair, Commissioner Engen, members of the commission, yes, if you decided to do it, we would have the cash to do it.
Do you have any figure in mind that's sitting there for emergencies? Where does it come from? This cash carry forward, what account or?
Where does it come from? It comes from budgeting, and our expenses are budgeted at a level and we spend less. Our budgets our revenues are budgeted and we receive more than we anticipated, and that's where the cash carry forward has come from.
So I think we should take a look at this at our next meeting. See if there's some with that, but man, they sure dumped this one out there on a short notice kind of thing, didn't it? That's all I have.
Thank you. So Karma, you'll reach out to Tom Ford, and he can help you or walk you through the service agreement and how that's completed, and then gather your information that you're going to present, I guess, once you have heard back from the city. Is that correct? That's what you were waiting on?
Yeah, I just know that everybody is going to want a little bit more information because it's not just one entity we're working on. You know, we're working with different entities, and so each one is going to want to know what the other one is able to do and how they can help. And so I will keep this group apprised of where we're at with that.
Okay, well, thank you very much, and we will talk to you. You know, it could be at our next meeting, which is going to be what, August 18th? Or if you need more time, it can be the one following as well. But then we'll need to let Ms. Nelson know so that we can get you back on the agenda at the point that you are ready to make your presentation.
Okay. I would guess that by the August 18th meeting, I would be able to have more information for you. Even if it's not an exact ask, it would be a further update. We are having a meeting of our stakeholders group that involved the 42 people plus or minus a few, again on August 11th, and at which time we'll have a little bit more direction from Altru and also from our fundraising team, and hopefully from the mayor and the state as well. So if nothing else, it could be an update for you because I would appreciate keeping you guys updated.
Thanks, Karma. Wish you the best.
Thank you so much, Madam Chair and Commissioners.
Take care.
If there's no other questions, I'll log off.
Thank you. Take care. Okay, so the next item then is Michaela.
Thank you, Madam Chair and Commissioners.
I'm here today to seek your approval to post 4-H Achievement Days out at the fairgrounds on August 29th and 30th. The spread of COVID-19, of which both Kari and Dustin have looked at and said looked about as good as we can possibly make it. It'd be just our livestock events. The plan is to have them outside as long as it does not rain. Anytime that people would be within less 6 feet of each other, we would ask them to have a mask on. But we're going to be encouraging face masks throughout the day. Both days that we were there, we'll be making announcements reminding people to wash their hands, to stay distant, to have their masks on. We'll be asking our judges to wear masks too because of the close interaction that they can have with our 4-H'ers. And if it is to rain, we plan to move it into the livestock building out there, and we would require everyone to wear a mask because of the close quarters. We plan to get extra hand sanitizing stations to have out there, as well as lots of signage. Yeah, that's about all I have. I can answer any questions that you have about it.
Does anyone have any questions of Michaela? I talked to Kari earlier today, and she said that, she had no problems with the go-ahead on this one. When I was reading through it, it got muddied for me, and I'm not going to second guess what Dustin and Kari had done, but it talks about face coverings will be required anytime when people are not able to maintain social distance. And then there's another spot that talks about face coverings will be provided if requested. And another one that talks about face masks are strongly encouraged. And then another one that talks about volunteers will wear a face covering. And then there was another section that never spoke to masks. So, I mean, it's like, if you're there for the day or 2 days, I mean, when do you wear a mask and when don't you? And so I just wanted to make that comment. So
Okay.
As long as you are strongly encouraging, better yet, that they do wear masks.
Yeah, Madam Chair and Commissioners, we plan to strongly encourage it, and any time of which people would not be at least 6 feet from each other, we would like them to have a mask on.
Sounds good. Thank you very much. So, Commissioners, you've heard the request. Do I have a motion?
Motion to approve, Commissioner Falk.
Okay, we have a motion to approve. Do I have a second?
Second.
And we have a second. Any discussion? Hearing none, all in favor?
Madam,
Yes, yes, sir.
Chair, this is Commissioner Hagan.
Yes.
This is a great plan, but the whole thing is the execution. I know we've seen some other plans that people aren't paying not as much attention to. I think you folks will be doing that. You're dealing with kids and all our animals and that kind of thing. And 4-H kids are probably willing to listen. But that's the important part. Great plan if you have to stick with it. So good luck with it.
Thank you.
Thank you, David. Those are nice comments. My guess is my feelings in this group that, with the 4-H'ers, Michaela, and the individuals that are going to be involved with this, is that they're going to stay on top of that. And so I don't have any concerns with that one at all as far as wearing masks. If they say it, they're going to follow through with it. So, okay, so we have a motion and a second. All in favor signify by saying aye.
Aye.
Bye.
Opposed? Motion carried. Have a great day with that. Great 2 days.
Thank you.
Yeah, thanks, Michaela. Okay, so the next item then is Kari had contacted me, and she didn't have anything to present this evening, but she is on the line, I believe, and available if commissioners have any questions of her. Any questions from commissioners? Okay, hearing none. So we'll move on then to county engineer. Nick, are you with us?
I am, Madam Chairman. Yeah, Nick West here. couple items to run by the board. But before we get into that, we just talked about, you guys were talking about COVID and events. And so I am the vice president of the North Dakota Association of County Engineers, and our annual conference is scheduled for January of 2021, and it has been for a number of years. We just had our little meeting video conference today with that group, and if you guys aren't aware, the October conference with the Association of Counties is not going to be live. Anyway, it's not going to be in person. And so we're talking about what that's going to look like. And so I just want the board to be aware, because I think the board is aware that this conference, I've mentioned it before, is coming in January. And I don't know what that's going to look like. Oh, and it's, as the vice president of the group, it's my job to run the conference. So I got to organize all the speakers and run it all. So we'll see what that is. Everything's on the table, from still holding it to, or still trying to hold it, to doing a hybrid, to just doing virtual. And so I don't know what's going to happen here. I know we're going to wait until we still have an October meeting scheduled, and we're going to try and make a final decision then. And hopefully by then we'll have the schools going. We'll see how that looks and how that's impacting the COVID, and visit again at a closer date. But we don't want to make a decision right now yet, because we still have, or we feel like we still have a couple months to make a final decision on that. But yeah, so we're just waiting. But just wanted the board to be aware of that. It's definitely on our radar to think of and try and plan. So
Thank you.
Yeah. The first item I have would be just a little bit of an update for the board on that June 30, July 1st flood we had that rocked really the central part of the county. And there's a lot of repair work going on. We've been having semi-loads of culverts come in and out. It seems like every week it's just busier than heck around here. But things are slowly getting back repaired, and the emergency stuff has been taken care of. We did submit an application for FEMA, and that was submitted last week, or the Department of Emergency Services submitted the application to FEMA for approval. And our county had about $1.2 million worth of estimated eligible damage on township roads, on non-federal aid county roads, and water board natural stream damage. So that's where we're at. In the state minimum is $1 million, so we hopefully will qualify, and hopefully we'll get some funding for that. So that's good news. And then we just did, a couple weeks ago, we heard that the spring flood was approved through FEMA. So now we have that going on. And basically we have 3 requests going on. We just submitted the one for this summer. We just got approved for the spring, and we're just finishing up receiving all the money and distributing for last fall. And it's a lot, between Debbie's office and our department and emergency services. It's just a whole. But we're moving through it. And we're glad to have FEMA, because without it, it'd really be hurting our budget even more. So, but one thing, 2 weeks ago, I had a conversation with somebody from Emergency Services regarding buyouts, generally speaking, from flood-impacted properties. And we're working through it, but you guys there's been some residents that have had major impact from flooding frequently, and some of those sound like they might qualify. So just an update for the board that you'll probably see that coming through either highway or emergency services, some kind of a potential buyout for some residential homes. And so we're working through that and seeing what that could look like. And I don't know where that's going to go. We're just in the preliminary stages right now too, but we're working on that. I have had a handful of calls from residents wanting to be bought out. And either their homes flooded, or they can't get to their homes and they're tired of it, and they're tired of taking boats, especially up in that Manville Osso area. So they want the county to buy them out is what the phone call is, but which also leads into my item B, which is the item Bridge 13506 buyout. Kind of a segue into that. So we have a bridge. Hey Tom, could I get control screen share there? And I'll show the board just real quick on Google.
Yes, let's see. I'm gonna make you a co-host, Nick.
All right.
And then you should be able to do that.
Okay. Does the board see a Google Earth image of the county?
Yes.
Yeah.
Yep.
Okay. So we have a bridge just right north of Manville, about 2 miles. I'll just slowly zoom in here.
Know exactly where it is.
Right there. Okay. It's a very poor bridge. It's by rating, it's the second worst bridge in the county we have. It only serves this home right here. Oh. The road doesn't go anywhere else. This road right here is a township road. It's on the section line. Township claims it. They put gravel on it. We plow the snow. They claim that, but the road dead ends. And as we go east a little bit, the road doesn't exist through here where I'm moving my cursor right now because the river's there. And then the remaining section line is just a dirt trail because all it is farm access. It's never been built. So these folks here, they get cut off during floods. They got to take boats in and out. And they want to sell their home. And I think they're about $300,000 range. But this bridge is in very poor shape. And in the near future, it's hard for me to say when, but 10 years, probably, something should be done. It's going to need to be replaced. If that bridge goes down, we have to provide access to that home. One way or replace the bridge. And we all know what these bridges cost with that Northwood Bridge, and that's the same size structure we're talking about. If we want a concrete bridge, it's $800,000. Or we build a new road from their house and loop it around the river and tie it back over to the township road over here, and then they can get out. And that is an option, but we'd have to buy land from the property owner, from the farmer. I don't know if they'd sell it or not, but I feel that we are responsible to providing that access. So I just want to throw that out there to the board that I'm working on options. I've been visiting with Haley. We don't have any answers yet. I don't know where the funding would come from, because I certainly don't have $300,000 extra dollars in the highway department this year. Maybe on a normal year with a year's notice, we could work it in. This year, no way. 2021, small chance, but these folks want to sell their home, and it'd be nice if we could work something out. I'm visiting with Department of Emergency Services on a potential buyout option if that's available. But I truly do believe in the best interest of the county, if we can get rid of that bridge, it's going to be a good day. And to do that, if we buy the home, it's cheaper than putting in a new bridge. And that would be the best way. I visited with both townships, Turtle River Township and Perry Township. They have no issue. I visited with one of the farmers in that area, and they don't care because they don't use it. I really don't see how this impacts anybody else other than that one single family home. So hopefully in the next meeting or two, I can have a specific request to the board and I have some information. But at this point, I just want to throw it out there to the board. Yeah, I do have a couple of pictures. So that's what it looks like as you're driving into the yard. And we do have a lot of problems, but probably the biggest problem we have, I'll pull it up here, is this is a picture of the northeast pier, and there's 4 piers, one in each corner that hold up the bridge. And right at the water line, the pier is totally rusted out. And just all that's left is a pier. There's a concrete small column in the middle holding it up. And yeah, so it definitely needs some attention soon. And you know, this could be fixed with some maintenance work. We could shore that up and buy some time. But the bridge as a whole, you know, this bridge isn't going to last another 50 years. But, so I don't know if there's any questions for me from the board, or anybody has any comments or thoughts on that. Or...
Madam Chair,
Yes, sir.
this is Dave. Nick, how long have those folks lived there, and have they been flooded out many times? What's the history, if you know? And for example, what is an appraised value rather than just what they're telling you for a buyout?
Yeah, so they bought the home 2 years ago, and we've had 4 floods in 2 years. And of course, when they bought it, they didn't know anything about it. They're military and moved in and had no history or knowledge of flooding and Red River Valley issues. And in the past 2 years, they've had to take boats to their house 4 different times, and they're selling and they're moving. Now the house itself doesn't flood because they have a ring bank around it. So the house itself is okay, but you can't get in and out. And the price he quoted me just roughly at $300,000 is a number he gave me, the owner, and he said he paid about $250, $260 for it a couple years ago, but he completely remodeled it, of course, and it's all brand new inside. And I'm just taking his word for it. And I told him no matter what's done, a third-party appraisal would have to be done and negotiated, and the county can't do that because that'd be conflict of interest. And I asked if he would order that now, so we'd have that sooner than later, and I don't know if he did or not, but yeah, it's probably right in that $300,000 mark, give or take 10%. So.
Hey, Nick?
Yes.
You may want to contact Don Keeley or Don Mont at Red River Regional Council. They may still have some buyout programs for flooded property.
Okay, will do. Yes.
Yeah, that may be an option to look at, because I know they were real active in previous years with that funding. I don't know if it still exists to this point, but it may be an option.
Okay, thank you, will do.
This is Commissioner Falk, and I'm concerned that one of the problems we would run up against on that is it sounds like this property itself, the house doesn't flood. The access is just flooded. Is that fair to say, Nick?
Correct, yes.
So that'll probably create some difficulty for us, although I fully support you. I think it's a project we need to look at because it's going to be cheaper in the long run than buying a bridge.
Any other questions?
This is Dave. One problem I have though is there are people throughout the county who would love to be bought out. And, I guess the bridge is what makes this one unique, but even so, it's kind of a difficult, thing to start doing.
College, we have never done this before. I did reach out to, my cohorts at the other highway county engineer superintendents, and this exact scenario has not been done to my knowledge. I didn't get responses back. I got a few responses on a little different scenario, and there have been times where public dollars have bought homes, but they're more related to, we need to move the road and your house is in the way, so we're buying your house. Or, you know, like the Fargo diversion, those kind of scenarios. Not like this. I had a great conversation with the Walsh every year because they can't afford to fix them, and they just barricade them off and done. Or just no more access, drive around. And yeah, and we're fortunate enough we haven't had to do that yet. But he said, but the people always have a way out. They always have another way out. If they close the bridge, they just go the other way. Of course, you can't just cut somebody out completely and say, tough, too bad. But yeah, to me, this is unique. And, you know, because I look at it economically, and the house is cheaper than a bridge. Plus, we don't have a future bridge to maintain ever. 100 years from now, we don't have to replace that bridge again. And county owns it, and we never allow it to be developed. And that's my angle. So.
And this is Commissioner Falk again. Yeah, this one is really unique because there's only that one house. And I think if we decided to tear that bridge down for our own economic benefit, we would be obligated legally to buy that residence out. So it's a little different, or it's not a little, it's completely different than all the rest of the homes that might be requesting buyouts in the county.
Correct. And we do have a handful of these, or not a handful, at least maybe 3 I can think of off the top of my head throughout the county. And for the life of me, I can't understand why the bridge was put in there, but it was. But this one came up, homeowner wants to sell, and the bridge is in poor shape. The other bridges in the other locations are in fair shape. They have quite a bit more life in them, so not as worried about those ones. Tons?
Any other questions? So I have a question for you, Nick. What would it cost to just put in a box cover with wood rails and a single lane cost, roughly?
A box culvert?
Well, yeah, is that the cheapest?
Well, it would be, but it wouldn't be sufficient and wouldn't meet the hydraulic requirement of our rules for bridges. This is the Turtle River. You couldn't put a box culvert in big enough to work.
Okay.
It's got to be a bridge.
I just remember it was small. It wasn't just a big span of water, but that was 3 years ago. So, okay, so, but you're saying the cheapest bridge would be about $800,000?
Well, for a new concrete one, yeah. Yeah.
But,
Unless, yeah.
okay. But if we're only serving, it's only serving one family, can you have a cheaper version and still meet standards?
There's some prefabricated metal bridge options that could be cheaper, but they're still going to be more than that house.
Okay, but when you're talking about the house, if you're, let's say it's worth $300,000, that's what it appraises at, then, you know, you're going to have to, I mean, obviously you aren't going to let that house sit. You're going to demolish it. So what's that going to cost us? I mean, to demolish property and haul it away is costly. you know, and then if you don't put in a bridge, you're gonna have to demolish a bridge and have it hauled away. So if you add all that stuff up together, where are we at?
That's a great question, and I've never demolished a house, so I'm not sure what it costs, but,
Well, then the
next
county's
year
stuck
I'll-
with land that's not usable.
Correct,
Now we own it.
yep.
But I, you know, I don't know that you're gonna save that much money, but if you add demolition and you add, I mean, the place would probably have to be burned, actually, because that bridge isn't wide enough, I don't think, to get much out of it, is it, out of that area? Or, well, what is it, 22 ton or something?
Yeah, we would have to haul it out in small loads. Yep,
So why, how could they do, you know, from the east, that township road that's coming in, and go around that grove? And make a road, I mean, could they do that?
Yes.
What would the cost be on that?
yeah, you have to build a road from here, you have to build it around the river.
Yeah.
Drawing out here. We'd have to buy land and build a road.
Well, and it doesn't have to be a big road, I mean, it could be a single road with,
Right.
you know.
That would probably, in the short term, be a cheaper option. The other issue you have is then you still have access problems. The people that live there still get flooded out.
Well, the house doesn't.
You could probably build a road cheaper than $500,000. You know, it's a mile. You have to buy some land. Hopefully the landowner would sell. And build the road and go around. It would be contradictive of what Kari and I and Wells County are trying to do in this area, and that's to get people out of here, to mitigate the repetitive flood loss. So we just submitted a grant application to do a study that is hopefully approved soon, to look at how we can reduce repetitive loss in this area. And that includes buying out homes and just moving people.
Well, it would be nice to have some figures on demolition, and, because you're gonna demo a house, you're gonna demo any outbuildings that they have, and it looks like there's outbuildings there that are gonna have to come down as well, and then you're gonna have a bridge that you're gonna demo, and so that all is gonna add up. I don't know if it's worth that.
Oh, absolutely.
Maybe it's
Yeah,
better to put in a cheaper, bridge for them, one that's safe and is gonna meet the needs. They've got the ring guide around their house, so. And out on East Lake, they have to boat across. So, you know, pretty soon we'll be buying all of them too. I just don't know, we want to get in, I just think it'd be good to have some more information on that stuff so that we could make a educated decision. I hear what you're saying, I appreciate that, and you know, and if you just say, yeah, the cost of a house is $300,000 and it costs $800,000 for a bridge, yeah, it makes sense. But there's costs there that we aren't looking at yet. And that's the demo stuff.
Yep. Oh, definitely.
And other options possibly with that road coming from the east. I mean, if that's a possibility, if a farmer, because the township's road is there. A lot of people drive on township roads, so it would just be from the time it hits the grove and around it, would it not?
Hear me out, what was the question?
I said the township road is there, so, and I said a lot of people drive to their property on a township road. I don't know, there are different levels as well, but if if the township road is drivable, then it would just be a road from around the grove of trees.
We would have to build this white line or yellow line I drew here. That would have to be constructed.
What? Okay. And that part is what I'm not understanding that. So if there's a township road that exists, why do we have to build a road?
Because if the bridge isn't there, I mean, at some point, we're either gonna have to build a new road or build a bridge. One of the
It's a grass road now. It's just a trail now, isn't it, Nick?
what's on the east of the house,
Yeah.
there is no road. It does not exist. We would have to build it, which isn't which is certainly possible, but the problem could be, I'll zoom in here if you can see my map. The part that loops around here would have to be on private property, and we would hopefully have a selling landowner to sell us the land. The part that's right here, the straight east-west part, well, there's a section line there, so we would have the legal right to build a township road there as access, whether the farmers wanted it or not. We could put a road there. I mean, that's my opinion on access.
Do we know that he doesn't own that property around that road?
Oh, but he does not know. I know who owns that,
Okay.
and it's not the people that live in the house.
Okay.
Madam Chair, this is Commissioner Falk. I think we can talk about this for the rest of the evening and not make a whole lot of progress. It seems to me it's all dollars and cents. We just have to get estimates on how much the road would cost or how much a cheaper bridge would cost, and then versus what take buying this property and demolishing it. Demolishing it, in my mind, wouldn't cost much. I've seen a track hoe in action. 4 hours on a piece of property is going to just be a pile of rubble. So, I think we need to hear back from Nick what the costs are going to be, and that'll tell us which way we need to go.
Yeah.
Thank you.
Okay, any other comments? Hearing none, we'll go on to Sheriff Schneider, Vision Zero Coordinator position.
Well, now, good evening, Madam Chair, members of the commission. Today I come before you with a request for chair signature on a contractor services with the North Dakota Association of Counties regarding the Vision Zero coordinator position for the eastern section of North Dakota. This document's been reviewed by State's Attorney Wamstead and Ms. Theo as well. We've been working with the state diligently here the last week and a half or so to finalize numbers, services, and make sure that it met our guidelines and the state's guidelines. And at this point, we're ready to proceed with a signature. I guess I'm here and available for any questions that you or the commission may have.
Commissioners, any questions?
Do you have anybody in mind for that?
Whoever applies.
Okay.
I have a feeling that we've already been getting some people who have heard, I'm guessing due to county commission meetings about the position being a possibility. We've had some overqualified individuals already reaching out with high interest due to the services that are going to be provided and the strong correlation with communities and still some law enforcement related services that they'll be providing. There's a strong interest in law enforcement officers that are looking to do more outreach services versus chasing cats and dogs or responding to alarm calls. So we will definitely have a substantial application pool with the appropriate salary.
So help me remember. The state's paying for this?
Correct. So it's state funds that are coming through the Association of Counties.
Okay.
And it's a 4-year contract right now that, nothing can be confirmed, but at this time, they are intending that this project project will continue to just grow and thrive bigger and bigger. The governor and the state traffic coordinator are both very strong proponents of Vision Zero in our state. And they reached out to us to be the pilot county to launch this. And they're already planning on feeding off of what Ms. Steele and the Sheriff's Office and the Commission developed to start branching this out to 4 other districts.
So does that contract also include benefits?
It does. So it includes salary, benefits, and then travel, equipment, supplies, including cell phone, etc. That's all factored in. There was some discussion with the state regarding, since this would be a county employee, what happens if the county employees or the county commission votes to provide a step increase or a COLA increase. And the state has been spoken to about that and stated that that shouldn't be a problem. They wouldn't have an issue with that moving forward. They do factor that into their grants that roll forward, and some communication with Ms. Steele and Lisa Johnner with the state. They discussed at length about the appropriate salary to make sure that it is in comparison to what the other positions will be offered at throughout the state. So, one of the largest counties in the state or largest regions isn't underpaying what somebody out west would be paying, since it is all going to be the same position. So we've come to, I believe, somewhat of an agreement as to what that would be, and that's discussion a little bit further down after we have a signed contract.
So there's no cost to the county on this one
Correct.
for 4 years.
Correct.
So then in 4 years, I didn't read the contract, because you would tell me. But in 4 years, if we can't afford this, or we feel it's not working or whatever, can we break that contract?
Yes, we can. There's a termination clause in there. I believe it's 60 days, written
Okay,
notice
do
within
the
60
same.
days that we can terminate, and they can as well.
Okay, you've heard the request. Anyone wish to make a motion?
Move approval, Commissioner Falk.
Okay, we have a motion to approve.
Second.
And we have a second. Any further discussion? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried.
Thank you, Madam Chair, members of the commission. I have nothing further.
Thank you.
Thanks.
Oh, what is this? Contractor services, do you need chair signature on something?
That's it.
Yeah, that was the request.
Did we talk about, did
That's
the
it.
motion
That was the
say
motion.
chair signature?
I just approved the contract.
Oh. Okay. And so thank you. Finance and tax.
Madam Chair, members of the commission, at the last meeting, you approved going vote by mail for Grand Forks County with one phone site at the Alaric Center. I didn't ask for an early voting precinct at the last meeting, but I'm bringing that request today. I think we want to encourage our citizens, our voters, Grand Forks County to vote by mail, but there's going to be possibly a large sum of people that will turn up on election day to vote, and to eliminate the long lines, potentially the long lines that we might see. I would like to have an early voting precinct out of the alerts Monday through Monday, October 26th through November 2nd, running 10 a.m. to 6 p.m. every day, except for Saturday, 10 to 3.
So I just want to make a comment. Back when we had the primary, we had a church in our community that offered their church and staff at no cost. Is that something we want to pursue for this?
Well, this isn't going to be at a cost.
Well, there would be at the Alaris, would there
Yeah.
not? No? We don't,
for the facility.
they don't charge us anything? Okay, all right, I thought we were paying up there. No? Okay, all right.
We would pay for workers, but I mean, if the church wants to send workers, they can send workers. And we need the largest space possible, so I don't know
They have
how
the
big
large
this
space. how big the church is and stuff. Large space, but that came to mind, and so I was thinking we were paying for the Alaris, and we were, the cost with getting staff and the inability potentially of getting enough staff to help for those 7 days.
Yeah, we will be looking for people to help. But I have to give it to the district chairs first and we'll allow them find workers first. And when they don't, then I have to find workers.
And so if the governor, depending upon the COVID situation, could we back out of the early voting?
Absolutely, if the governor decides that you do not have to have a full invite, you could then decide not to.
Any questions, commissioners?
Now, Madam Chair, I would make a motion that we establish the early voting precincts at the Alaris Center Monday, October 26th through Monday, November 2nd.
Madam Chair, I would second that motion.
Okay, we have a motion and a second. Any further discussion? Hearing none, all in favor signify by saying aye.
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 Opposed? Motion carried. Thank you. Anything else for us?
That's it.
Director of Administration, Mr. Ford.
Madam Chair, I have nothing for the board tonight.
Thank you, sir. State's Attorney, Ms. Wanstead.
Madam Chair, I also have nothing for the board tonight.
Thank you. Committee reports, Commissioner Ross.
Just the MPO, it looks like the hydraulic studies have been done on the sites for a second or a bridge over the Red River, and haven't had a chance to study it a lot yet. I think they made presentations to the city council, and they have talked to some of the MPO members. But I should be able to find some more out next week, I think. We have another meeting, so.
Well, and if you look at watch the city council or the council of the whole or whatever it was, when they talked about it, it was a good meeting.
Yeah.
I mean, there was a lot of good information shared,
Yeah.
so.
But the whole thing's been hinged on the hydraulic study being done in all those sites, so.
Yeah, Okay, anything else?
Nope.
All right, Ms. Beach?
Madam Chair, I have nothing to report tonight.
Thank you. Commissioner Engen?
Yeah, thanks. There was an excellent BRIC meeting this morning by Zoom, and the UND folks put on an excellent program on research at UND, and I think it showed how important partner UND is in the saving the base kind of approach that we are always working on. So that was good. Yesterday I watched the video presentation on Siren, and it was a little over my head some of the time, but boy, that was a good presentation too. I'm sure Kari was on that one. And that's all I have.
Thank you, sir. Commissioner Falk?
We just had the semi-annual meeting of the Grand Sky and the Grand Forks Air Force Base in Grand Forks County, and it was pretty routine, so nothing to report.
Okay. And I don't have anything to report either. So unfinished business or new business, we have none, no correspondence. May I have a motion to adjourn?
I so move.
Do I have a second?
Second, Falk.
All in favor signify by saying aye.
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 Opposed, motion carried. Stay safe, everyone.
Thank you. Thank you.
Bye now.
Bye.